What's the rarest disease you've seen a patient correctly self-diagnose? Subarachnoid hemorrhage. My guy straight up walked up to the desk and said, "I've got a headache out of nowhere. I think it's one of those spider hemorrhage things." We didn't take him seriously until the CT scan came back. To be fair, he was walking fine, talking fine, and didn't have any light sensitivity. Said the pain was a 5 out of 10. The guy could just handle pain really well. Because I have some people asking, we ended up transporting him to another hospital. We were small and not equipped for all that. We took him via ambulance to a larger hospital and was met outside the ambulance bay, and he was taken directly to the surgery unit. I saw him like 6 months later in a store and he had a bit of a stutter. I would say that it was the allergy to meat after being bitten by a Lone Star tick. It was a young kid, maybe 8 to 9 years old. He would only eat tacos per the mum's instructions. He had tacos that night and had no other foods that day out of the norm, nor new medicines, lotions, detergents, shampoos in his routine. He had urticaria, hives, up and down his arms. Mum did recently remember pulling a tick that didn't look like a deer nor dog tick out of him and felt it looked like a Lone Star tick. I had no better diagnosis for the lady and referred her son to an allergist. I'd never heard of this allergy before the mum told me about it. I worked at a pediatric clinic and we had a mum properly diagnose her 9-month-old baby with Tay-Sachs disease. He wasn't progressing developmentally and ended up passing away at 18 months old. I'm actually very freaking jealous of all these doctors whose patients are helping out with the diagnosis. Mine are all just saying, "I have chest pain in my toe when I go number 2. I had an 11-year-old girl who didn't move her bowels for a week. A week! Told me she thought it was her girl parts that weren't working properly. After a full workup and finally a CT scan of her abdomen and pelvis, which I hate doing on kids because of the level of radiation, I found out her uterus was so full of blood it was causing full-on bowel obstruction. Her girl bits were so imporforate or closed up that she couldn't menstruate and all the blood just stayed in her uterus. She required an emergency hymenectomy and was sent home the next day. Hot damn if she didn't call it from the get-go. Scurvy. Why he didn't just start eating foods with vitamin C, I'll never know. That was right up there with diseases that I just didn't think people got anymore. The old pirate disease. Classic. Just goes to show you that some kids do not want to eat their fruits and vegetables, and some parents sadly can't be bothered making them do so. Although the replies to this story were full of college-age students actually getting the same disease from only eating cup noodles, so I guess it could just be a really irresponsible adult as well. When my oldest was born, he peeled a little, like babies may do, but it kept getting worse and he was flaky and had scales. The pediatrician told me he had dry skin and to lotion him up. Dr. Google claimed it was a condition called ichthyosis, but that was super rare, so no one believed me. Anyways, fast forward 6 months and a referral to a dermatologist later, and he's got ichthyosis. Also, after my first was born, I had excruciating pain just under my ribcage, mostly after I ate. Tums did nothing. Gas X did nothing. Did a little Googling and it sounded like gallbladder attacks, only it's on the wrong side. I go to my GP, get an ultrasound. My gallbladder was full of stones. Got a referral to a surgeon who dragged me for a month, claiming it couldn't be my gallbladder, the pain was on the wrong side. Meanwhile, I was having attacks after every meal and stopped eating except ginger ale and club crackers. I lost over 10 pounds. Call the surgeon daily in tears. Finally, he agrees to operate, but right before the procedure tells me that once my gallbladder is gone, I'll still have problems. Woke up from surgery and found out my gallbladder was worse than they thought, so it needed to come out anyway. 2.5 years later and I haven't had any more attacks. Guess it was my gallbladder after all. Bird mite infestation. The lady wasn't taken seriously at first and came off as a psycho. Nope, the birds built a nest in her AC ductwork. Patient here. Self-diagnosed a still unknown fungal infection inside both eyes. It took making them glow with a rock lamp to get attention. Kept seeing strands in both eyes, then wow, that UV lamp. Ended up on one heck of a cocktail to save my sight. Kids, don't wash your eyes with river water in a tropical rainforest. Just say no. A nurse friend brought her newborn to the pediatrician in '63 and told him her son had Wilms tumor. The guy blew her off and told her she was a nervous mother and a little bossy boots. The kid was starting to crump when a pediatric oncology guy noticed and saved the baby. My friend dumped the pediatrician. A patient turned up clutching some internet printouts about visceral leishmaniasis. Luckily, I managed to resist saying anything sarcastic as that's exactly what she had. I appreciate it's not uncommon worldwide, but in UK hospitals it's pretty damn rare. And I was grateful for the printouts, it saved me a lot of searching. As a physician and a med school doctor, it's pretty distressing to read all of these. I told the doctor I had, enter the fairly common disease and typical symptoms here, but he or she didn't believe me. We teach our med students to ask the patients if they have any idea what they may have. Doctors need to take the patient's opinions seriously. Much of the time, the patient has already spent hours researching the disease and may have some experience with it, especially if it's a familial disease. I may require my students to listen to these stories. I'm not a medical worker, but my grandmother self-diagnosed herself with Chiari. She had been having problems and everyone in the family tried to tell her it was nothing. She ended up needing brain surgery and still suffers from it. I had a resident tell me a patient was in the ER saying he had a worm in his eye. Why does he think that? I asked. Because he feels something in his eye. I patiently explained to the resident that often people have a speck of dust, so you just have to look carefully all around the eyelids under the slit lamp, which has a microscope. As I was talking and examining the patient, lo and behold, a worm wriggled right under the surface and I jumped back and nearly fell off my chair. It turns out the patient was visiting from Africa and his father was a veterinarian, who told him to come to the hospital to take the worm out. These parasites are common in Africa, not so much in the US. The entire infectious disease department was very excited. Years ago, a woman who'd been taking calcium supplements made from ground horse bones diagnosed herself with lead poisoning. I recall she was a movie actress. Impressive in that I think none of her doctors saw this, and there was, at the time, no reason to believe that a calcium supplement would have a lot of lead in it. But of course, animals store lead in their bones, and until leaded gasoline was phased out, every animal pretty much was getting very high exposure. I have to add an editorial comment about lead and mercury. The counter-argument I've heard when I expressed concerns about exposure from fish and gasoline is that, "You're gonna die anyway, you could be hit by a bus." I'm puzzled to the point of anger by such stupid responses. Is the argument since you can be hit by a bus, you should not try to avoid being poisoned? Especially since the result of neurological damage is not sudden death or even death at all, but rather a sometimes hideous diminution of quality of life. Who would say, sure, take off 10 IQ points, I might be hit by a bus? Sure, that makes sense. 5th year med student here, diagnosed myself with lymphoma. Everyone thought I was being a classic paranoid med student, but it turns out I was right. Finished chemo 2 weeks ago. I would imagine that just simply learning of all these completely horrifying ailments could make anyone a hypochondriac. Good on you for staving off the self-doubt and working out what was really going on. Not particularly rare, but I had a guy diagnose himself with Guillain-Barré syndrome and a lady diagnose herself with Charcot-Marie tooth disease. I worked in a health department for a while looking at infectious diseases. 2 things seemed constant. 1. The vets are really good at self-diagnosing zoonotic diseases. 2. Their doctors rarely believe them. In my time, we saw 2 uncommon diseases, psittacosis and tularemia. Vets are well-trained anyway, but to be fair, it's a pretty obvious leap from I treated a dog with X to, oh, now I have X too. The psittacosis was from some kind of exotic bird and had infected the owner. The owner had already had a cough when visiting the clinic, and the vet recommended that the owner see her GP. But the GP refused to order the tests until the patient was extremely sick. If I recall correctly, the lady survived, but a lawsuit came from the ordeal. No idea how it ended. Bird survived too, I believe. A different vet herself got tularemia, treating a stray cat that was brought into the clinic. To be fair, it's very rare in cats as well. The cat sadly died despite treatment. The vet's GP was not convinced she could have contracted the disease so quickly. The health department had to intervene and insist the vet get treatment. I honestly have no idea why anyone would flat out deny the possibility when a known exposure is present. ER physician here. I once had a patient, a middle-aged man, who self-diagnosed a glioblastoma multiforme. It turns out he'd been having headaches, nausea, blurry vision for about 6 months. He didn't seek medical help until a couple of weeks before I'd seen him. At first he was treated with simple NSAIDs and rest, but was ordered a full set of tests. Between visits to his primary care physician, he saw an episode of the television series ER, where one of the characters had similar symptoms and was diagnosed with glioblastoma multiforme. So when he came to the ER, because he developed dysarthria and a persistent headache, he bluntly said he might have this particular disease. Obviously, I didn't believe him since glioblastomas are not very common and television is fantasy. Well, after the MRI scan showed it had that particular brain cancer, I couldn't help but marvel at his self-diagnosis. But deep down, I wish he was completely wrong, because glioblastoma multiforme is one of the most aggressive brain cancers there is, with an extremely low survival rate. When I told him about his diagnosis, he didn't get angry or sad, just said it was okay. He knew it all along and was at peace with his immediate future. I followed up on him for some time and he died 3 months after my visit. It was one of those weird circumstances that, in my line of work, makes you think that there's something bigger than us all around us. You can submit your own stories to be featured here on the channel. The story submission link is in the description below. And if you want to listen to some vibey music in the background, check out easymode, also linked below, and subscribe. I had a patient who correctly diagnosed herself with mastitis, although she was very worried that she had had an inflammatory carcinoma of the chest. To be fair, they can look similar. Another time, I had a patient correctly diagnose a lump in her breast as a fibroadenoma. I was very impressed. Man, I got a giant abscess, and everyone kept coming to look at this giant, pus, blood-filled bubble on my chest. No one had ever seen mastitis go this wrong before. Stupid family doctor made me suffer and ignored me for ages until I ended up in the ER. The nurse admitting me was like, "How long has this been going on?" To be fair, it only grew and became crazy that morning, but the lump I had would not go away no matter what I tried. Is it just me, or are doctors sometimes like, "A totally abnormal thing going on with your body? Let's run some tests." Unless it's on a lady's part, in which case it's just a lady mystery. Probably hysteria. Oh, it's not just you. They've done all kinds of studies. I went into the ER in severe pain and was sure it was kidney stones. I told the nurse that and got a long lecture on how I do not self-diagnose, just tell the doctors my symptoms and let him figure it out because he's the professional. The doctor comes in, I describe my symptoms, leaving off my ideas on the matter, and they do some blood and pee tests. The doctor comes back and it turns out I did have kidney stones. I looked at the nurse, who happened to be in the same room at the time, and she just huffed and walked out. The doctor looked confused and I told him the whole story. He laughed and said something to the effect of course patients should tell me what they think the issue is and why. I may not come to the same conclusion as you, but every bit of data helps. Not quite the same, but this was so creepy and sad I had to share. One of my dad's co-workers went to pick up a patient with the ambulance, and they started talking during the drive to the hospital. The patient told the co-worker that he had a very special type of cancer, and started listing his symptoms. Co-worker thought to himself, well crap, this sounds like a lot of the issues I've been having, and decided to get himself checked out. It turns out he had the exact same type of disease, and died a few months later. Damn sad that even catching it ahead of time didn't help the guy in question here. I don't even know if it's silver lining that they got a few months to sort out their estate. Honestly, I'd rather not know and then cark it one day without living in dread, but maybe it wouldn't have been that simple either. It's not rare or a disease, but it always terrifies me when a patient says they're going to die and then later actually freaking dies. We had a girl say this and then later die from a PE. She was young too. Just so we're clear, this girl died within 45 minutes of predicting said death. She was unloaded from the gurney after being brought into the ER for difficulty breathing and started complaining of back pain once on the bed that was brand new for her. Then 45 minutes or so later, we pronounced her time of death. The nurse was traumatized because this young girl said it with such conviction. We later found out this girl was on birth control pills and figured it was the reason she threw a clot. Sad day, man. I should probably leave this here. How often do blood clots occur? Blood clots are generally rare but sometimes occur in otherwise healthy people, even those not taking CHCs. Between 1 and 5 of every 10,000 women who are not pregnant and not using CHCs will experience a blood clot in any given year. This number increases slightly if the person uses CHCs. Between 3 and 9 of every 10,000 CHC users will experience a blood clot in any given year. This girl might have had a bunch of other risk factors for a PE as well. Possible long periods of immobilization, recent surgery, trauma, who knows. The only risk factor I caught wind of was birth control pills. It's something providers in the ER typically ask about if a female comes in complaining of dyspnea with no history of respiratory problems. I work in pain management and a lady had symptoms that other doctors didn't believe. She was labeled as a substance addict or someone seeking narcotics. She came to our office in tears, just telling me she felt pain in random places of her body with no abnormal imaging or other symptoms. She stated several times that she felt she had something inexplicably wrong with her and that she wasn't lying for pills. We discovered she has a very rare case of chronic regional pain syndrome, more severe than any other case we'd seen. Sadly, there's no cure, but at least she has an explanation as to why she has pain for no evident reason. Not a medical worker, but I am a rare case of WebMD being right about cancer. Felt a lump in my throat for upwards of a year and a half, but doctors kept telling me it was in my head. They stuck cameras down my throat and nothing. It took an ultrasound after giving myself up and my PCP saying my thyroid felt slightly enlarged for a doctor to find it. One ultrasound and a biopsy later, they found out I had stage 2 papillary thyroid cancer that metastasized to 18 lymph nodes. Myself with lupus. Been having issues with chest pain and a myriad of other symptoms that never made sense together. GPs don't want to look at the mountain of records they have for you, just the problem at hand. All tests for a diagnosis came back in normal parameters, but I insisted on a fail-safe I'd read about. I asked to be tested for syphilis. But you have no symptoms for that. I know. It's because lupus will show as a false positive on that. Done, and I have lupus. I also diagnosed myself with lupus. Went to 2 doctors and they didn't believe me. I was 16 and they claimed I had the teenage blues or it was anemia symptoms. Finally went to a 3rd doctor when I couldn't go on feeling like crap any longer. Turns out I was in stage 4 kidney failure from lupus and they were like, yeah, you need to see a rheumatologist tomorrow. Pyloric stenosis. A couple brought in their little one with exorcist-type projectile vomiting. Exam and ultrasound confirmed the diagnosis. My daughter had this. I didn't diagnose it though. The doctors kept telling me there was nothing wrong with her and she was just spitting up, even though she couldn't keep anything down. I finally took her for a 3rd opinion and there it was. The doctor said the other ones probably didn't diagnose it because it's rare for girls to have it. She had surgery the next morning and she's fine now 15 years later. Found out later that a bunch of relatives, all girls, have had this. My older brother is developmentally disabled. For the longest time, all the psychologists and school counselors said he was ADHD and had some learning disabilities that he may have obtained in utero. My badass mum, with only a high school diploma, never really accepted that this was all that was going on with him, but listened to the doctors anyway. Fast forward to when my brother was 10 years old and my mother read an article about Fragile X syndrome. She happened to read about a rare form of it called Frax-E. The article perfectly described my brother's condition. My mother then decided to talk to a genetic counselor about getting my brother tested. The genetic counselor kind of scoffed at her diagnosis but went along with it anyways. Lo and behold, my brother had the exact form of Fragile X she had read about. My mum not only diagnosed my brother, but she also found out that our family was a carrier for Frax-E. It turned out my mum was a carrier and my grandpa had Frax-E. It was amazing because all my grandpa's life he fought with feelings of inadequacy because school and learning new things were really hard for him. He was held back 3 times in high school. When he found out there was a legitimate medical reason for this, it completely changed his outlook. We had a 20-year-old patient come into the hospital because his girlfriend was laying on his chest and told him his heartbeat was a little fast and sounded weird. He came in and said he had an irregular heartbeat or arrhythmia. According to his Google research, he said he may have AFib. He was correct. While watching a documentary about Asperger's during class, I had a portent and slow realization that what they talked about was disturbingly accurate on a personal level. After running through some screenings, months later, because diagnosis screenings are far more focused on children than adults, the doctors were wondering how it managed to be undetected during my childhood. I actually think a lot of people who are on the spectrum on some level probably go through life completely unaware of it, just due to a lot of pressure while growing up to repress or ignore their more neurodivergent tendencies rather than diagnose and treat them. And it was even worse for the people before our generation too. Not really a rare disease, but when I worked in the district hospital, I had a patient who came in for a 3-day fever saying that she might have hepatitis A because she had some shellfish over the weekend. She had no other symptoms. I laughed it off. Her full blood count did seem to indicate a viral infection, but I was thinking of dengue, which is a very common thing in that area, or just your run-of-the-mill viral fever. Fearing the former, I scheduled her to come on Saturday, 3 days later, to review her dengue antibodies test result. It so happened that I was working half day that Saturday. It so happened the lady was yellow on that Saturday, jaundiced from the hepatitis, and the IgM came back negative. Boy, was I humbled. She was hospitalized in a tertiary center and came for a follow-up a few weeks after, and she was fit as a horse. I knew a guy who diagnosed himself with appendicitis within 1.5 hours of the symptoms appearing. It was very impressive for someone with no medical expertise. Rarest diseases are often easier to self-diagnose than medically diagnose, as the patient will jump to the worst conclusion with no data, and the doctor will start at the most likely and test down from there. I had a guy come in one night and diagnose himself with a broken tibia. Wasn't as impressive as it sounds, as it was sticking through his skin. I correctly self-diagnosed my hypochondria. I diagnosed myself with a condition called hidradenitis suppurativa. I've struggled with it for 25 years, been to several doctors who just threw a 2-week antibiotic at me and told me to come back if it returned. When I asked why I was having one of these flare-ups, they usually just shrugged and said I was just one of those people who were prone. I was never given a diagnosis. I started really looking into it about a year ago and went to a new doctor where I explained in detail why I believed I had the condition. After examining me, she agreed and has been wonderful in helping me treat this, with practical remedies and an open mind and listening ear. So glad that I found her. I self-diagnosed myself with allergy to carrot antifreeze protein. For some years, after eating raw carrots or having fresh carrot juice from the fridge, I was experiencing a tingling sensation in the throat and I could feel it swelling. At some point I realized I was allergic to carrots, but only to the raw ones. The weird thing was that this wasn't always the case. I sometimes had raw carrots and had no symptoms at all. The cooked ones were fine. Then about 8 to 10 years ago, I watched a program in which they mentioned that carrots can produce a natural and, at the time, only plant antifreeze protein. Carrots make it in response to excessive cold. They also said that some people may be allergic to it. This protein is also broken down while carrots are cooked. This struck me as, that's it! So I did some tests. I can happily eat raw carrots that have been pulled out of the ground with no symptoms. However, raw carrots that have been in the fridge for some time will give me narrowed and itchy throat. When you subscribe, make sure to hit the bell to turn on notifications. Put the playlist on in the background to finish listening to all the stories, or if you want some vibey music to put on in the background, check out easymode. If you like Am I the Genius, give Am I the Jerk a shot. Everything linked in the description.